A young family's life turned upside down. What happens when your 3-year-old gets brain cancer? Today, we see the tears, the joy, and the hope for little Olivia. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Just about 10 weeks ago, 3-year-old Olivia Robinson had trouble opening her right eye. A 5-centimeter tumor, roughly the size of a lime, was growing inside her brain, and it was growing fast. Since then, Olivia has gone through emergency brain surgery. And just last week, she wrapped up 6 weeks of radiation treatment, followed by a princess party right here at the hospital. Today, we are joined by Olivia's parents, Robert and Bree Robinson, as well as Dr. Danielle Cunningham, the radiation oncologist in charge of Olivia's radiation here at the University of Kansas Cancer Center. Welcome to all of you.
Good morning.
Good to have you. And just thank you for being here and willing to speak about your emotional journey. And we're really excited to hear about Olivia and how she's been doing. I mentioned about Olivia's eye. She was having trouble with the eye. But Rob and Bree, you had already taken Olivia to the hospital for a different reason. Tell us about that.
Yeah, so Olivia started out with a lot of vomiting and a lot of GI problems. It lasted for about 3 weeks, and then on September 5th, we started with our first emergency room visit. They diagnosed her with constipation and sent us home. When we got home, we knew that wasn't in our gut, that just was not right. It didn't seem right. So we called her pediatrician here at KU, and they directly admitted her here, and she was admitted for a week. We saw some improvement, saw a little bit of Olivia come back, and we went home. And then about 24 hours after being home, she began to decline again. And so we felt, you know, there's something more going on. We need more answers. And that's when we turned to Children's Mercy emergency room.
So that gut feeling, is that how you remember it, Rob? I mean, this is your first child, but the gut does not lie.
That's right. The gut does not lie. All of the diagnostic criteria and everything they told us up to that point all made sense, you know. Said she had an ileus, her bowels weren't moving, you know, she was having some gastroparesis, her stomach wasn't emptying, all secondary to an infection. It all made sense, and she did get improvement, and you know, she was feeling better and she was back to her normal self. And when we discharged, we really thought that everything was going to be just fine. But yeah, whenever, you know, 24 hours go by and she's just in extreme pain on the couch sleeping, we knew there had to be more to it, and we just knew we had to get answers, and it was challenging, and it stumped a lot of people. So
you get a brain scan. All of this leads to ultimately a brain scan, and then you learn she has a tumor. When did you learn that that tumor was cancer? So
we found out about 5 p.m. roughly on the 13th about the scan that there was a growth on her brain. We were in surgery the next morning. At that time, we still didn't know what it was. Of course, they have to be sent off for tests for them to do testing on it to really kind of diagnose exactly what it is. But the way I remember it in the moment is that they told us that they were able to see it divide under the microscope in the operating room. So they were pretty confident it was an aggressive form of some sort of cancer then. Even though we didn't have definitive answers, we knew pretty much immediately that this is going to require further treatment.
So Bree, this is worst nightmare come true. What is going through your mind at the time?
I remember, as if it was yesterday, the doctor sat down with us and told us that they found the mass. And I just told her, no, it just didn't seem right. It just, you never believe it's going to be your child. And we just felt like our world was shattered right before us. And then, you know, it just felt like we kept getting, you know, news of surgery, news of cancer, news of needing radiation, and it just never felt real. And I don't know that it still does to this day.
Rob, yeah, what do you remember in those moments? I mean, just kind of this whirlwind. Was it kind of just get into fight mode where we got to figure this out? We got to get her across the finish line. As a parent, what's going through the mind?
A million and one things, things that you never thought you'd have to think about with your 3-year-old daughter or any daughter or any child at that point. At first, it was very shocking, very devastating. We had amazing friends though and family that showed up the day of. My cousin, she drove all the way down to the city that night. We had a bunch of friends meet us at the hospital because we didn't know what the next day was going to bring. So there was a lot of support there during those devastating first 24 hours. But because it advanced so rapidly, it was 100% fight mode. Once we knew that we had a plan and what we were going to do, we had to be there for Olivia, and we had to be strong, and that's what we did. And to this day, we're only 2 months into it, so we're still in fight mode. It's still very much every day is a battle, and what are we going to do to make sure that she comes out of this stronger on the other side.
And then you're living by the words on your shirt, Olivia Strong.
Olivia Strong, yeah. If you didn't know her, you would never know she was sick. Strongest little child I've ever seen. Got up every day, came to treatment, never complained, never cried. Even during the entire process with the brain surgery, I think the only thing she really complained about was the Band-Aids they tried to put on her. She didn't like the stickiness, but yes, she's a very strong little girl, absolute blessing.
And you must agree, doctor?
Oh, yes.
Tell us what you know about Olivia.
She's a very strong child, very smart, very sweet.
Well, tell us a little bit more about this type of brain cancer, ETMR.
Yes, it's embryonal tumor with multi-layered rosettes. It's a very, very rare tumor. We see maybe 100 cases worldwide each year, so it's very, very rare.
So, Robin Bree, the tumor, as we talked about, was operable. We have CT scans showing the before and after. Before is on top, after is on the bottom. How did the brain surgery go at Children's Mercy? Just tell us a little bit about that experience before you came here to us.
Like I mentioned, it happened so fast. We found out about it on an evening of the 13th, and then the next morning at 9 a.m. we were in there ready to rock and roll. So scary, nonetheless. I think any time that you have to worry about opening up a brain, especially on a child, it's just devastatingly scary. I think the surgery lasted about 9 hours or so. So 9 hours of just being in the waiting room with friends and family, waiting for answers. We got through it. They came in, they talked to us. They told us that for the most part it was removed. There were some left behind they couldn't get to. There was a little bit right behind her eye, some on some blood vessels within her brain, some things that were unsafe to take out that we knew we'd have to treat further. But they said that the surgery overall was successful. The thing is that it was pushing on multiple of her cranial nerves in her brain. So they were worried about her being able to talk. They were worried about eyesight. They were worried about being able to open her eye. They were worried about swallowing. They were worried about a multitude of things that, again, it's just devastating to hear that your perfectly normal child might have changes to their future. The great team at Children's Mercy, they monitored her and they followed up with her, and to date, no problems. So like they said, for instance, her eye probably wouldn't open for 3 to 6 months. I think 2 weeks in, it was already open, almost like it was before the procedure.
And Dr. Cunningham, of course, we partner with Children's Mercy quite often. What are those conversations like? You hear about this patient, Olivia, over at Children's, and that they were not able to get all of the tumor out. Talk to us about where you come in and how radiation therapy plays a part.
Yes, I heard about Olivia from one of my colleagues at Children's Mercy. He called me on my cell phone and he says, I've got this little girl, I'd like you to see her. And I said, absolutely, I'd be glad to see her tomorrow. And because these things, they shouldn't wait. And so I think the most terrifying thing would be when a family gets a scary diagnosis and they don't have a plan. And so that's our goal, is to provide that plan. That way we know we're in action mode and we can keep going.
So you get her here and then you get a plan together, a radiation plan. What is the goal of that?
The goal of the radiation is to kill any cells left behind after the surgery and to maximally prevent things from coming back in the future.
And what are we seeing here on the screen?
Yeah, so you're seeing my radiation dose map, and so it all starts when we do a radiation planning scan and we get some additional MRI images as well. And then we map out every scan that we've done for Olivia, the pre-op, the post-op, any additional other imaging. We map out the tumor cavity, any area where the tumor is left behind, and then an area at risk where we can't see any changes, but we know there could be tumor cells living in there. And then we create a volumetric arc therapy plan to best treat that.
And how did she respond? How did the radiation do?
We actually saw some shrinkage of the existing tumor we knew about during the radiation, which was very nice to see.
And how did she, I was going to ask you, but then I'll ask Mom and Dad, how did she handle all the trips coming in, and what did that look like day to day?
She was actually very excited to come in.
Really?
Every night she would go to bed, she would say, where do I go when I wake up? And we'd say, we go to the doctor. And she would walk in, the nurse would give her the badge, she'd badge in the door, she'd come right in, hook up all of her stickers, her blood pressure cuff, her monitor stickers, everything. She did it all on her own by the end of all of it.
So she just kind of made like an experience out of it.
Yes.
And
yes.
she was quite the trooper. So of course you're the voice of your child when you're talking about a 3-year-old. What questions did you have through this process, the beginning, the middle, towards the end, and beyond? Because I know we're still not done with the treatment, but tell us a little bit about that, especially for somebody who's listening who may be going through it or may not know they will go through it.
I think the biggest thing from the beginning was, is there hope? Is there a cure? You hear so many stories that there's not, but we chose to look at hope, and we chose to turn to that more than anything. And that's all we've seen along the way, is we've heard so many devastating news, but along with that we've heard amazing news through all of it. And I mean, her day-to-day is a blessing. Seeing her, I mean, she's a walking hope of light. She's what keeps us going.
The biggest question I probably had is this team going to take care of us? Are they going to help my daughter? Our first day in the door at the radiation center and meeting Dr. Cunningham really took a lot of stress off our plate. We felt very much at ease knowing that, you know, just meeting her and knowing that we had a great care team there that was going to take care of her. Most of the questions you don't know till you know them. So you don't know until they pop up what's going to go through your mind, and it all moves so fast with this whole process that sometimes we were just in the complete trust of them, you know, letting them take over because we didn't have time to ask questions. And I felt ultimately confident completely in letting them take care of our daughter. And to this day, I think that we've made a great choice, and I think hopefully she's on the right path.
And something really exciting happened because last week you all as a family were able to ring the bell, marking the end of radiation treatment. Lots of our care team there to watch and support. And Rob, we want to play a clip of what you had to say to this group of folks right here.
As we came in through this process, we didn't know what to expect. We didn't know what was going to happen. It all happened so fast. And to come in every day, whether it was just a smile on your face, whether it was dressing up as a turkey, whether it was putting shoes on your ears trying to make Olivia giggle. You have given her so much joy on a process that's been so hard that if anyone ever tells you or you think these don't matter, you're absolutely wrong. And everything you guys have done day in and day out matters to more people than you possibly understand. So please remember that, okay? Don't stop doing the fun things. Don't let anyone tell you it's not professional. If you have a child in there, and you want to make them laugh, because that's what's going to matter to their lives.
All that emotion pouring out of you, Rob. Why was it so important for you to just share that message and for them to hear what they've all meant to you?
It was important that they heard that. I'm in healthcare also, and it's so often we get caught up in the day-to-day lives and taking care of our patients, and we become, I don't want to use the word numb to it, but sometimes we do. And I also don't feel like in society we appreciate people enough. And I just felt like they all did such an amazing job that I felt like if no one else told them that how much they appreciated them, that I needed to be the one to do so. And just like I mentioned earlier, Olivia doesn't know what's going on with her. Right? She's very much living her normal childhood life. So for her to come in every day in a very scary situation and to have nurses like Bailey and Dana that we had there at the care center just try to make her laugh and try to make her smile and try to calm her nerves, being a little toddler, meant the world to me. And so I just felt like it was necessary for them to know how much I appreciated them, and that I hope they never stop, and that even if people don't tell them thank you, that they need to know how much what they do means to people.
And something they did was created a special badge for Miss Olivia. Tell us about that, Bree.
Yeah, she came in one day, and she always would grab the nurse's badge to come in, open the door. Mommy has a badge just like it too, so she kept playing with it, and the next time we came in, they had one made just for her.
She's official.
She's official. They always made jokes. She's an employee of the University of Kansas Health System.
Kind of like an ambassador.
Yeah, yeah.
Dr. Cunningham, what's it like, though, to see the nursing staff kind of do what they do, which is go way above and beyond just the care of the patient?
Our nurses are incredible at KU, especially our nurses that take care of our pediatric patients. We're so lucky to have amazing nurses that can spend a lot of one-on-one time with our families, especially those that need daily sedation, like our young patients like Olivia during their treatment.
And you made something special for her too.
Oh yes, we do our best to make things really special, and so I knew Olivia's favorite color was pink and her favorite animal was a giraffe, and so I did crochet her a little pink giraffe just to kind of try to associate coming to the hospital as a positive experience.
So I think you do enough though, Doctor. Radiation oncologist by day and a crocheter by night. I'm pretty impressed. There she is. I mean, it's pretty spectacular what you all do down there. Tell us about the tiny hands. Who's going to tell me about that? I don't even know what this is about, so please do share.
One of the nurses, Dana, had these tiny hands that she would stick in her sleeves, and you can see them there. She would bring them in a few times, while being there to just make Olivia laugh. Another way that she would try to brighten her day. And she even gave Olivia her own tiny hands that she has, and at home she puts them on her fingers, and she can kind of play and
clap.
She'll clap.
They
with
pull out
them.
all the stops down there. I'm telling you, they do. Love it, love it. Let's talk about the princess party. Tell us a little bit about that. Who was there? Kind of take us inside.
Yeah, they always knew Olivia loved princesses. Elsa, there was one day she was sedated and heading back to radiation, and she started singing Let It Go while she was asleep. Oh, wow. So she's always loved princesses, and as we approached the ending of radiation, they shared with us that they were throwing her a party. We don't really know whose idea that was, if it was a collective idea, but someone in the care team decided that needed to happen and that needed to be celebrated. So we invited family, friends, coworkers, anyone that has been there along the way with us.
It was very, very cool to see.
Us, yeah.
What's next for Olivia?
Next steps, probable chemotherapy will be the next steps. As we mentioned, we've been going through this whole process so quickly that we're kind of just waiting for the next step and the next bit of information. But we'll know more soon for going through the next stage of treatment and what that's going to look like.
And what are the positive changes you've seen in Olivia through all this? I think she's probably like your hero now, but tell us about that.
She seems just happier. We look back at the several months leading up to all of this, and I found that she, was throwing a lot of tantrums. We thought it was a toddler thing. She is 3. But looking back on all that, we think it was the tumor causing those moments that she was having, and we don't see that in her now. She is happy, she's smiling, she is playing. She rarely complains. I mean, she just is a happy toddler living life like she should be.
She's Olivia strong.
Yeah, she is. Yeah, she is. What advice do you have for other parents facing a similar situation? What would be the one thing you'd want them to grab onto?
Whenever this first started, we didn't know if we were going to internalize it, if we were going to keep it private, tell people about it, tell the world, tell few people. The best decision we ever made was that we're going to tell everyone. We wanted prayers, we wanted hope, we wanted support. And so everyone's going to handle this differently, but don't be afraid to lean on people out there that are there for you. I've had a hard time accepting gifts and accepting support and accepting all the wonderful generosity that's out there, but it has really made a huge difference to where we can just focus on our child, spend time with our child, and really appreciate every minute. So if you have a support system, lean on them. Don't feel bad when people are there to help you, and just take advantage of the generosity of your friends and family.
Yeah, they want to do that because there's so little they can do. Dr. Cunningham, how important is the hope that you see here with Bree and Rob, and for parents to show up every day and for their kids?
We're so inspired by our families and what they go through. I just, every day I'm really inspired by my patients and their families. Hope and positivity are super important as they go through this process because it's not easy. It's really difficult, but hope and positivity gets people through those difficult moments.
It matters.
It really does.
The mindset matters. In fact, Robert, you put some thoughts and feelings into a poem, didn't you? And
Yes.
I was going to read some of it, but I'm actually going to pass this over to you because I think it sounds better coming from you, Dad. But just that right there, just read a little bit of that, and then just tell me what went into your writing.
Life is hard, but there is always hope. Life is sad, but there is always happiness. Life is negative at times, but there is always positivity to be found. None of us are promised tomorrow, not just Olivia, but you and I as well. Enjoy your day as you never know the curveball coming tomorrow. I thank God daily for our daughters and continue to pray that Olivia continues to make progress and kick this cancer's butt.
Absolutely. Why was it important to write this down?
I sat down and decided that I needed to get some emotions out, right? Tell people about what's going on, because everyone asks, how are you doing? How are you guys handling things? They don't really know quite what to say. And so I felt like if I could just get it on paper and send it out there, then people could read it. I also think it's important for us, but also other people, that life should always be about perspective. We have gone through this whole process with, after the initial devastating news, we could have shut down and been devastated, or we could have looked at the positivity of everything and try to look at the hope that's there. The tumor could have been inoperable. It wasn't. She could have had problems after surgery. She didn't. They couldn't have responded to radiation. It did, right? So it's all about perspective, and that allows us to really have hope, is to try to look at the happiness in the sadness, because, again, she doesn't know she's sick. And if we're devastated and aren't there for her, she's going to pick up on that. So we have to be as happy and positive as possible to give her the life that she deserves right now.
Not always easy, but you're doing a darn good job of it, right?
Thank you.
Thank you for sharing that. And you can send a comment or a question for Rob or Bree or Dr. Cunningham. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkinson joining us on this Monday.
Yeah.
Good morning. How are you?
Yeah, very cold. Very cold. It's
I know
good
my
to be
kids tried to get me
inside.
out sledding yesterday. Not happening.
Right now, we're doing pretty good in the health system compared to where we were last week. 17 active infections, down from, I believe, 24. So very good as far as the active inpatient COVID numbers, and hopefully everybody had a very good weekend with loved ones, friends, family, and are not ill today.
Hawk, okay, so you saw a new study giving new confirmation that young kids saw far less respiratory problems during the first 2 years of the COVID-19 pandemic. Other studies have already proven that all the masking and social distancing lowered the level of flu and RSV cases, but this new study looked even closer at young children with complex medical issues. So what did it find?
Yeah, this was a Canadian study, and they had data from 2017 all the way through to 2022. So they're actually able to compare pre-pandemic area or time period with the pandemic time period. And what they saw was that over that 2-year time period, they saw a substantial decrease in the severe illness and death. And they actually reported that over 44,000 hospitalizations were saved during that 2 years of 2020 and 2021 with kids with severe respiratory illness. And they do really believe that it was those mitigation factors against SARS-CoV-2 that helped reduce that. Obviously, we know it's not just black and white, and there were other areas. Obviously, there are cons during that time period, such as lack of being around other people and things of that nature. But if we are looking at just the disease state itself, they did see that those mitigation efforts, which we were using to help protect against COVID, did also help those young and those very vulnerable children from that severe respiratory illness, and they saw a substantial decrease in those hospitalizations during that time period.
All right, Hawk, thanks so much. Let's
Yeah.
get to some questions from our viewers this morning. And the first one is, Dr. Cunningham, what kind of radiation did Olivia get?
We chose to do volumetric arc therapy, also known as IMRT for Olivia, which is a fancy kind of photon radiotherapy.
And explain the different types of radiation. It's not a one-size-fits-all for people.
No, there's been very many different kinds of radiation that are available. There's photon, proton, electron, and even orthovoltage radiation.
And nice to know that you can specifically target exactly what Olivia needed.
That's right.
Just another question is, what is involved in a radiation session, and how might it be different from an adult to a child?
Yes. For every part of radiation starts with the radiation planning scan, where we make a mask, especially for patients undergoing radiation above the clavicles, just to keep everything in the exact same place every day. And then we need some time for some radiation treatment planning to make an individualized fancy radiation plan. And then when radiation begins, patients lay on our table. The machine, it rotates around them but doesn't touch them. It feels just like you're getting an X-ray. It's painless, and you walk out the same way you feel walking in. The only difference is if you're too still to lay on the table for 15 minutes, like when you're 3 years old, you might need to go to sleep for your treatment, and so that causes people to be in our department a little bit longer.
Okay, some comments today. What a sweetheart. Hashtag Olivia Strong. Go Olivia. Best wishes to this family. What a beautiful child. So a lot of love and support surrounding you this morning, just for you sharing your story. And you mentioned it a little bit earlier about encouraging people to share and to talk about it and to lean on people. But what reactions have you gotten? And because some people may not know how to handle a situation like that. Cancer is not an easy topic, and then you're talking about someone's precious little child. It's not easy to share and to talk about.
We got a lot of sorry. I think a lot of people don't know what to say in that situation when they hear our stories. A lot of shock, a lot of faces of shock. And I think in the moment all they can say is sorry. They don't know what to say. And that they're there for us, and they truly have been. So many people, our neighbors that we had never really met, were there for us. Friends, family from all over. We have a friend in China. I mean, there's so many people reaching out to give us that support when they hear our stories.
Rob, is there anything someone should say in this situation? Because you're right. I mean, sorry would be the natural thing to say, but because you know people certainly are. But is there anything that people can specifically do or say that would be really helpful for someone in this situation?
Don't say too much.
Okay.
Okay.
Less is more.
Yes.
Yeah. Okay.
Because you're right. People don't know what to say. So sometimes I think you feel obligated to try to say something. And just because we're strong and we're going through this and trying to be positive doesn't mean everyone is. And sometimes what you say, they might not take it the right way. So just apologize, be there for them. Actions speak a lot louder than words.
Love that, for sure. Who's been the biggest support? Who are some groups or people in your world that have been your biggest support?
Friends and family.
Yeah, it's hard to narrow it down. I mean, our friends and family have really come together. We have a very close-knit group of friends. You can see there.
Church group, they always come through.
Oh, that's just our friends and family.
That's our friends and
Oh,
family.
that's just your friends and family. Okay.
We invited them all to join us at church.
Oh, nice.
To celebrate this.
That's showing up right there.
Yes, yes.
And I have to ask you, what has this done for you two as a couple? How has this changed your relationship? And what are some highs and lows? Because we know they're in there.
Yeah.
It's challenged us in different ways that we would never expect. I think it's strengthened us. I mean, it's something a couple, a married, they should never put their child through this, but
if we can get through this, we can get through anything.
Yes.
And we know that we have to be there for Olivia. And so every day we get up and we put on a smile and we go and we play dolls, and we appreciate every minute of every day, which, to be honest, you don't always do as a parent. And so now we appreciate our child more than we ever have.
And I think where he can't fill in the cracks, I do, and vice versa. We are a team throughout all of this, and we're leaning on each other.
Great message. I want to get our takeaways today. Dr. Cunningham, I'll start with you. For someone watching, what do you want the takeaway to be?
I'm just really inspired by our patients and their families every day, and it's so important to go to a dedicated center that takes care of pediatric patients, and so we're just so glad that we've been connected with this family.
You stay connected, don't you? Families are like family.
That's true.
They never really leave you.
Yeah.
Bree, what's the takeaway from your family's story?
I say trust your gut. I mean, I think back to how this all started, and in the end, that's what we did. We thought, are we being crazy with how sick she is? Maybe this is just a bad GI bug, and she's going to get over it. But in the end, our gut told us different, and we listened to that, and we advocated for her. And we are here today because we did that.
Yeah. Or moms, we're supposed to be a little crazy.
Yes.
That's the way it goes, right? And usually we're right. So, Rob, first of all, just thank you both so much for sharing your story and sharing Olivia with the world. Rob, just wrap us up. What's the takeaway from your story, from Olivia's story?
If I haven't hammered it home yet, never lose hope. There's always hope to be found, just like what I read earlier, is that it's all about perspective. And no matter what anyone tells you, you never stop fighting and you take care of your child. And it doesn't matter whether it's a devastating diagnosis like we've had or a random Tuesday. We never know what tomorrow is going to bring. So never lose hope and appreciate your families and look at them today and give them a hug. You know, appreciate them before you get news like this.
We will do it. And my hope is that in 6 months that we will bring Miss Olivia back on and you guys will have some really good news to share, and she's going to be trucking along. So thank you so much.
You're welcome.
Thanks
Thank
to all
you
of our,
guys for having us.
yes, you bet. Thanks to all of our guests, of course, our viewers for being with us today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Almost everything we know about sports medicine is based on male athletes. It's time for that to change. I'm Jessica Lovell on the next Morning Medical Update. Why women need specialized workouts and treatments. Plus, an exciting announcement and new partner in the University of Kansas Health System's mission. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.